Ever had a moment where your heart just feels off? It suddenly starts racing, fluttering, or skipping a beat. For a second, everything pauses. You feel slightly dizzy, a little more tired than usual, and then it's gone. Your heart goes back to normal, so you ignore it. You tell yourself it's just stress, lack of sleep, maybe too much caffeine, and you move on like nothing happened, just like most people do. And that's exactly why so many working professionals miss the early signs. Because what may feel small, random, and easy to dismiss at first might actually be the condition called arrhythmia. What is arrhythmia? A normal human heart beats in a steady rhythm, usually between 60 to 100 beats per minute, neither too fast or too slow. Each beat follows a precise electrical pattern that allows your heart to pump blood efficiently through your body. But with arrhythmia, this rhythm becomes abnormal. Your heart may start beating faster than normal, slower than expected, or in an irregular, uncoordinated pattern. This usually happens when the electrical signals that coordinate your heartbeat don't function properly, leading to a disruption in the normal rhythm. Types of arrhythmias. Clinically, arrhythmias are categorized based on how the heart rate changes. If the heart beats faster than 100 beats per minute, it's called tachycardia. If it drops below 60 beats per minute, it's called bradycardia. Some other types of arrhythmia includes atrial fibrillation, AFib. This is the most common type of arrhythmia where the upper chambers beat rapidly and irregularly, affecting proper blood flow. Atrial flutter. It's a type of arrhythmia where the upper chambers of the heart, atria, beat very fast but in a regular pattern, usually around 250 to 350 beats per minute. Supraventricular tachycardia, SVT, a common arrhythmia where the heart suddenly starts beating very fast, usually between 150 to 220 beats per minute due to abnormal electrical signals originating above the ventricles. Ventricular fibrillation, VFib. It causes the lower chambers of your heart to spiral into a rapid, chaotic rhythm, sometimes shooting up beyond 240 to 300 beats per minute, leading to sudden cardiac death. What causes arrhythmia? Now the real question is, why does this even happen? Arrhythmia is often triggered when your heart is under constant internal stress. And this isn't just emotional stress. It includes physical strain on the body as well. Things like high stress levels, poor sleep, excessive caffeine intake, dehydration, and long working hours. Over time, all of these can start affecting how your heart's electrical system functions. And this becomes even more relevant in high pressure jobs. Research suggests arrhythmias are present in nearly 2.7% to 4.5% of working professionals, with higher risk in those dealing with chronic stress or irregular schedules. Night shifts and rotating work patterns, in particular, are linked to a significantly higher risk of arrhythmias. So how do you actually recognize if you have arrhythmia? It's not always obvious and it doesn't always feel serious, but your body does give you signals. You just have to notice them. Here are 5 signs of arrhythmia you should never ignore. Unexpected heart racing or palpitations. Your heart starts racing, fluttering, or skipping beats without a clear reason, even at rest. Sudden fainting or feeling like you might pass out. Unexplained shortness of breath, chest discomfort or tightness. High or irregular heart rate at rest. Treatment options. So what happens if you do notice these signs? The good news is arrhythmia is manageable, especially when caught early. Treatment usually includes medication, lifestyle changes, and in some cases, procedures to control heart rate, stabilize rhythm, and reduce risk like stroke. Furthermore, individuals with a family history of arrhythmia or those exposed to consistently high stress may be at a higher risk than they realize. An ECG or extended monitoring, like a Holter test, can help detect irregularities early and guide timely intervention. If you've noticed any of these signs, connect with a qualified doctor on Visit Health today and get an ECG or heart checkup scheduled, because missing this once is all it takes. Download the app now.